Welcome to American Medicine Today, presented by the Bonati Spine Institute, featuring internationally acclaimed inventor of the Bonati spine procedures, Alfred Bonati, MD. Here are your hosts, Kimberly Bonati, and co-host Ethan Euchre and Jeff Wagstaff.
Welcome to American Medicine Today. I'm Kimberly Bonati alongside my friend Ethan Euchre and Jeff Wagstaff. So the new Omicron variant spreading across the U.S. and is already in at least, about 24 states?
The latest I heard was about 24. Yeah, wow. But I'm sure it'll be more by the time
Probably.
This airs.
Exactly. And many people have questions about the latest COVID threat. Joining us to discuss is Dr. Fahmi Farah, cardiologist at Baylor Scott White, All Saints Medical Center and Texas Health Hospitals. So thank you for joining us yet again.
Thank you for having me. It's a pleasure to be here.
Absolutely. So can you tell us, what is it that we've learned about this latest variant? Because by all account, they're saying it's more contagious, but much less severe. What is it that you've heard?
Yes, those are correct. We know that it's a lot more contagious than the Delta variant that we have seen, which is concerning because, we know what happened last winter with COVID-19 Delta variant. And when it's more contagious than that, we ought to be more careful. Yes. So far, it has not, the symptoms have been more on the mild side, especially in those who are vaccinated. So vaccines are going to be very important for us.
Right. Here's what I want to know, Dr. Farah, because it seems to be everything is politicized and has been for years now, and it probably will continue to be. But, I see when you watch more conservative outlets, they're saying not really a lot to worry about. I think even the CDC said what you just said, which is it's much less severe, mild, kind of like a cold or a flu. Then I saw on CNN recently that it's Wisconsin hospitals are at capacity and it's mostly young people and it's, the chicken little and the sky is falling. So I know you don't personally like to get into the politics of it, but what is your opinion? Not who's right, but kind of what are the facts here?
Yes. Strictly from a medical standpoint, I do believe that it is of concern. It is of great concern because we still don't have, a lot of our population vaccinated. And the fact that it's so contagious and we are in the middle of holiday season when we will be seeing an increase in gatherings and number of people traveling. So if it does spread the way we are worried that it may, our concern is that the hospitals can fill up. Last December, for instance, we were at capacity. We were having to turn patients away. We were, it was really bad. Even the hallways were taken up with patients, and that's something we simply don't want to see. And so that's why we want to take the measures and take the precautions. Precautions are always better than being reactive and being behind.
And my goodness, this was all unvaccinated? I mean, none of the already vaccinated?
I sense the sarcasm.
Yes. So vaccinated people, as you already know, they have done very well with this new variant so far. Really not any hospitalizations in them, not anyone in the ICU. So that goes to, for me, it's a clear message that the vaccine and the booster shot is going to be very important for us to continue. And we are at a good place in terms of where we were when we first started, even last year, in terms of fighting this pandemic. We're very close. So I think we need to keep pushing, keep getting the message across that the vaccination is going to be important. The precautionary measures are going to be important so that we can all come out of this and get back to our normal lives soon.
Sure. And what happens with those that have already had COVID, that natural immunity? Have you seen droves of those people in the hospital?
We did last year, and we have this year as well.
That already had COVID?
Yes. We already, for people, you're correct, people who have the virus, the infection itself, they do obtain some natural immunity, but that immunity we're seeing is lasting up to about 3 months. I've had many patients who have been reinfected after 3 months, and they were more severely ill when they got reinfected. I've had patients who were not hospitalized the first time, but ended up in the ICU and intubated on a ventilator the second time they got infected. So it's absolutely essential that people understand that natural immunity is not lasting that long.
Wow, that's so strange that only only like the Omicron and Delta and COVID react so very differently than every other virus people get, and the antibodies that seem to last forever, even years in some cases.
Just to jump in real quick, jumping off your point there, Kimberly, I just saw something on the news the other day that people that got the Spanish flu and recovered back in 1918, they redeveloped that virus, and people, the natural immunity from that, there's still, obviously there's not a ton of people left that age, but they're still immune from it. So it's so an interesting point that now all of a sudden it's different when it comes to natural immunity.
Overseeing a conversation last night among some friends, somebody made the comment that because this variant seems to be less severe, it actually may be more damaging, because the message sent to those who aren't vaccinated is it's not very severe, but the fear being that because it's not very severe, that may not motivate people to get vaccinated, causing this to spread, mutate, and then who knows what happens. What are your thoughts there?
You brought up a very valid point. The fact that it's not very severe, that message is a bit dangerous for the public, because we need to make people understand that it's not very severe in those who are vaccinated. And I hope that message encourages people to get the vaccination. It's an incentive. Also, the fact that it's not causing too much symptoms, you're right. It allows people to not know that they may even be a carrier and mingle and be around crowd. And it's a vector. It's a source of widespread. And you're absolutely correct. The longer this variant or this virus lingers, the more different types of variants we're going to see, and the longer this pandemic will stay with us. So it's very important that we clarify that. So thank you for that question. That was a great question.
Well, thank you for joining us yet again on American Medicine Today. We look forward to having you on again in the future. Thank you so much, Dr. Fahmi Farah, for joining us on the program.
Thanks, Doc.
Thank you for having me. It was a pleasure.